Today we're talking about something really serious, pancreatic cancer. You've probably heard it called the silent killer, and for good reason. Its warnings are incredibly easy to miss. But here's the thing, your body does send alarms. And today we're going to learn exactly how to listen for them. You see, pancreatic cancer is a real enigma. It's like a master of disguise hiding inside the body. And that's what makes its symptoms so dangerously easy to just brush off. So why is it so stealthy? And, what can we actually do about it? Let's get into it. Okay, let's start with a number that's, well, it's pretty sobering. 12%. Just 12. That's the 5-year survival rate. It's a figure that really, truly shows you just how aggressive this disease is. And what's really terrifying is why that survival rate is so tragically low. It comes down to this number, 80%. That's the percentage of patients who, understandably, overlook the early warning signs. I mean, there are things that are so easily brushed off as just everyday aches and pains, right? Until it's too late. And this really puts the scale of the problem into perspective. Over 65,000. That's how many lives this disease claims every single year, just in the US. It's quietly become more deadly than many cancers that get way more attention. Okay, but here's where we pivot. This isn't just about the scary stats. This is about solutions. Because like I said, your body does send signals. And get this, research is showing that a lot of these symptoms can pop up 3, even 6 months before a diagnosis is made. That's a critical, even if it's a small window of opportunity. And this is so important. I want to be really clear. This isn't about panicking over every little ache or pain. Not at all. It's about recognizing patterns. Because spotting just 3 of these symptoms together, well, that can boost the odds of early detection by nearly 70%. That's not just a statistic. That's power. That's knowledge you can use. All right, so let's get to it. Let's unmask these alarms. We're going to walk through 8 of the most surprising signs to watch for. And trust me, some of these are so common, you'll see why they're almost always dismissed. First up, digestive problems. Your pancreas is basically a little powerhouse for your digestion, right? It makes all these crucial enzymes to break down food. So it just makes sense that if a tumor starts messing with that process, the very first clues are going to show up as trouble with your digestion. And look, we're not just talking about a little indigestion here and there. We're talking about things like nausea or vomiting that just won't quit. Or maybe you're always bloated. You notice a big drop in your appetite and you're losing weight without even trying. But here's a really telling one. Changes in your stool. If your body can't break down fats properly, your stools might look pale, kind of greasy, and have a really foul smell. That is a major red flag you shouldn't ignore. All right, let's move on to sign number 2, fatigue. And I have to stress, this isn't the, oh, I had a long week kind of tired. Nope. This is a deep, relentless exhaustion, the kind that just doesn't go away no matter how much you sleep or rest. And here is the absolute key difference. Normal tiredness, you get a good night's sleep, you feel better. Cancer-related fatigue, it doesn't get better with rest. What's happening is the cancer cells are literally stealing your body's energy, just draining your reserves. It gets to the point where even simple things feel exhausting. It's this profound weakness that just seems to get worse and worse. Number 3 is a bit of a strange one, fever and shivering. A fever you just can't explain might actually be a clue. See, when a tumor causes inflammation in the pancreas, it can kick your immune system into gear, and that can lead to these really confusing on-again, off-again fevers and chills, but without any other signs of a normal infection, like a cold. Okay, now for number 4. This is one that is so often overlooked. For reasons we're still figuring out, pancreatic cancer can actually make your blood stickier. It makes it more likely to clot. The technical term is hypercoagulability, and it can pop up in a really specific and dangerous way. We're talking about something called deep vein thrombosis, or DVT for short. What you'd notice is probably some unexplained swelling, warmth, or tenderness, usually just in one of your legs. It might seem like just a pulled muscle or something, but it carries a very serious risk. And here's why. If a little piece of that clot breaks off and travels up to your lungs, it causes what's called a pulmonary embolism, and that is a life-threatening emergency. The symptoms hit you suddenly and they are severe. You're suddenly short of breath, you have a sharp pain in your chest, and your heart is racing. If that happens, it is a 911 situation. It needs immediate medical care. Okay, so the next three signs, 5, 6, and 7, are all kind of interconnected. They really paint a picture of what's going on inside your abdomen. You've got swelling, bloating, and pain. A tumor can actually cause the liver or gallbladder to swell up. It can lead to that constant bloating we talked about, and it creates a very, very specific kind of pain. So let's really zoom in on that pain, because the type of pain is a huge clue. It's usually this dull, deep ache way up in your abdomen. And here's the key. It often radiates straight through to your back, almost like someone's tightening a band around you. And two more critical clues. It often feels worse right after you eat, and it can get worse when you lie down flat. And our final sign, number 8, is one you can actually see. If a tumor grows in a way that it blocks the bile duct, this substance called bilirubin starts to build up in your system. And one of the first places it shows up is in your urine, turning it a dark yellow or even brown color. People often say it looks like cola. And this can happen even before you see any yellowing of your skin or eye. So let's put all these pieces together. The crucial takeaway here is that pancreatic cancer is so dangerous, not just because it's an aggressive disease, but because its symptoms, when you look at them one by one, a little fatigue, some bloating, back pain, they are just so incredibly easy to write off. But when we learn to recognize these quiet alarms, especially when they start showing up together, we can turn them into really clear signals. And that awareness buys something priceless: time. Time to act early. Knowledge in this case, it literally saves lives. And sharing this knowledge, well, that can save even more. So if you found this explainer valuable, please help us turn these silent alarms into a loud, life-saving conversation. Subscribe to our channel, Fresh Vitals, and more importantly, share this information. You truly never know whose life it might touch or even save. And we'll leave you with this to think about. What other silent alarms might our bodies be sending us every single day? Just being mindful and aware, it's honestly one of the most powerful tools we have for taking care of our health. Thanks for watching.